Thank you. I like going last because I remember what it was like being at my first Neil Patel syndrome conference and how overwhelming that was. And that was before I offered to present on the psychological side of NPS. I know that one of the values of being in person is a lot of what we like to do is do our show and tell, where we'd be able to show off our thumbnails, and that's how we greet each other, and or our fingernails, and how much extension we get in our elbows, and there's value in feeling like you're part of a community. I'm sorry that we don't have some creative way to do a show and tell here, because being part of a community is really important. So as we said in my introduction, I am a clinical psychologist. I specialize in health psychology, and I identify as a diabetes psychologist. So I do my full-time practice helping people with diabetes. And so it's always a big shift for me to start focusing on my own conditions. And it is actually emotional for me when I hear your stories and relate to them. So I am also a person with NPS. And this is my dad, who passed away 2 years ago. This is one of our last family gatherings. My dad had 5 children. My dad was a spontaneous mutation. My dad was spontaneous in a lot of ways, including his NPS. I was his first kid to have Neil Patel syndrome, so he didn't even know it was genetic until I was born. And then I wasn't diagnosed, or we as a family weren't diagnosed with Neil Patel syndrome until I was 12 years old. So my oldest brother, who's in the light colored shirt in the upper corner there, he's the only one of my dad's 5 children who didn't inherit Neil Patel syndrome. And then my brother Greg, sister Janelle, my youngest sister Melanie have Neil Patel syndrome. And so not only am I a person with Neil Patel syndrome, was a daughter, I'm a sister, I'm a mom. I have one son, Evan, and he has Neil Patel syndrome. He's 25. And my sister Janelle's son, Oliver, also has Neil Patel syndrome. So our experiences with Neil Patel syndrome ranged from age 80 down to age 5. So I thought might be just to, and this is not based on research, this is based on my own family experiences with Neil Patel syndrome and stories that I've heard from all of you. Some of you said it would be really nice to have some new data to talk about, and part of what makes living with Neil Patel syndrome hard is that there isn't a lot known about it. Research takes money. Rare disorders don't pull for a lot of investment, and so it requires really generous people like Dr. McIntosh and some of his colleagues to take an interest in Neil Patel syndrome. So what's hard about Neil Patel syndrome often is it involves having a rare disorder. So having a rare disorder, whether it's Neil Patel syndrome or something else, really involves navigating the world being different. And we can be different to those who don't have Neil Patel syndrome, where we can be different even in our own families. You know, for those of us who have big families with Neil Patel syndrome, my presentation is different than my siblings. My nephew Oliver is the first one in our family to have eye-related disease to Neil Patel syndrome. My dad had significant kidney disease and went on to needing dialysis in the last year of his life. I seem to have hit the genetic jackpot and got a lot of the stuff related to it. Frustrations of being a patient. I distinguish as a person with diabetes, I'm a person first. So our role as a person with diabetes is different than our role as a patient when we have to navigate an already frustrating healthcare system. Having something rare means that very infrequently when we ever encounter a doctor who's had experience with Neil Patel syndrome. That's what was always cool when you hear Dr. Towers talk, and that she actually has patients, plural, with Neil Patel syndrome. Social challenges that come from having a rare disorder. I mean, explaining to others. I hear a lot of people tell their stories about, like, they're not believed when they say that they have pain because you look fairly normal, and just having to explain what it means to have Neil Patel syndrome can lead to a feeling of loneliness or isolation, especially for those of you who are the only one in your entire family that has Neil Patel syndrome and you've never met another person with it. And on the psychological side, so I did a little survey of my family and said, if I have only a few minutes to talk about Neil Patel, what would you want to make sure that I mentioned? And they said, my son Evan said, for him, coping with uncertainty has been really hard. Uncertainty meaning like the first time that he went for a hike when he was on this senior field trip in New Zealand, he dislocated his knee for the first time. And he says, I never really know when some nail patella thing is going to happen, and it makes me a little afraid. And so they're having skills for coping with that things change with nail patella syndrome, and one day is different from the next. Helplessness, that, you know, a lot of times we can only do what we can about what we can control. And a lot of times there's not a lot, and that results in feelings of helplessness. Body image issues are something that when I have a breakout session, I'll promise to talk more about. But when when we have a culture that focuses so much on physical perfection, having muscles that don't develop right and arms that don't go straight or nails that don't develop, can lead to body image issues. And some people end up struggling with that. And that's related to feeling of stigma, which is feeling like you're different in a negative way, and feeling like others see you as broken or defective, and then the social problems that can result from that. So people who feel stigmatized tend to anticipate rejection and start to avoid forming new relationships. For a lot of us, it's learning strategies to live with both acute short-term pain and chronic pain. I have both acute and chronic pain. Right now I'm dealing with a frozen shoulder that happened at the beginning of COVID, so it's been hard for me to get treatment for it. But I also have chronic pain in my knees and in my tailbone area. Depression is something that's been, that we know that when you have a chronic health condition that you are at higher risk for, and there may be a biological component to that with nail patella syndrome, as well as ADHD. In my family, of the 7 of us, 5 or 6 of us have ADHD. That seems like it's a little high for the general population. So, you know, I do wonder if ADHD, especially inattentive type, is part of nail patella syndrome. And for my siblings with nail patella syndrome, in some ways, the ADHD has been one of the harder components in their lives. So I don't want to just end with what's hard about nail patella syndrome, but to just a brief consideration of some strategies for living well, to know that you're part of this big community. It's so cool to see people show up from all over the world. That's a benefit of technology when it works, is that we can get connected and get support. I really challenge you to think about like what it means to be different, that be aware of your language that you label yourself with that marks you as broken or defective. There can be a lot of power in difference, and how the story that you tell yourself about that difference can really make the difference whether you struggle or whether you thrive with nail patella syndrome. There's some strategies for that too I would recommend for parents, but again, I promised that I'm willing to do a breakout session just talking to parents, especially for those who don't have nail patella syndrome. It's really important that you allow for tough feelings. Sometimes nail patella syndrome really sucks, and we just don't want you to get stuck there. So to be able to acknowledge tough feelings without feeling like you need to minimize them, but also not getting stuck there. Developing assertiveness skills is so important for navigating our healthcare system when you have nail patella syndrome. So learning how to advocate for yourself in a way that's respectful to the doctor, and how do you bring up nail patella syndrome, and how do you demand a certain kind of quality of care, and perhaps when you have few choices. Some of that is developing assertiveness skills and learning self-advocacy, and some of the people in this group are very gifted at that and offer a lot of helpful suggestions. And then I would offer, as my last thing, was to know when to get help and to have the courage to do so. Sometimes depression, body image issues, social isolations, or trauma from surgeries gone wrong, or chronic pain. There's a lot of questions about chronic pain. There are some psychosocial interventions that have been shown to be as effective as medication. In particular, mindfulness-based stress reduction. It's a type of meditation. I had a patient who learned this skill and was actually able to have a root canal, which you can't imagine, without any pain medication. So get help. and you don't feel like you have to suffer a certain length of time before you can get help. And now, through because of COVID, a lot of mental health professionals are moving their services online so that you know, even if you live in a more rural community, you can get help. And thanks for listening. That's my thumb.